Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program on 96.5 FM and WUFO AM. I'm your host, Francesca Messiah from Kaleida Health, Manager Workforce Development. And I want to thank you for listening to the program. And remember, we're an hour format. So this is the first half hour. And I look forward to having you stay with us throughout from 7 until 8 a.m. Well, I always have to first give a little overview of who is Kaleida Health. Kaleida Health, we're the hospitals. We're Buffalo General Medical Center, Oishei Children's Hospital, Gates Vascular Institute, internationally known, Millard Fillmore Suburban, the Visiting Nursing Association, High Point, and DeGraff, which provide long-term care and skilled care. And we also have DeGraff Medical Park. DeGraff Medical Park and DeGraff Long-Term are both located in North Tonawanda. Also, throughout Buffalo, north of the city and south of the city, we have all types of world-class medical facilities and clinics, everything from X-ray, pediatrics, OBGYN, cardiac treatment throughout the Kaleida system. Oh, I'm sorry, I forgot to mention our hospitals in Olean. We have a hospital in Olean as well as our hospital in Bradford, Pennsylvania. Thank you so much. And so today, our topic is one of the areas I just mentioned, the Visiting Nursing Association. We've not had the VNA on in a few years, maybe since before or around COVID time. So I will say since around 2022. And home health care, visiting nursing is about home health care, providing quality health services in your home for all ages, anyone in your house, newborn up until 125. And our guest this morning is the Senior Vice President of Home Care. Again, that's the Senior Vice President of Home Care, Lisa Griesler. Lisa, how are you this morning?
Good morning, Francesca. It's a beautiful day. I'm well, and happy early Memorial Day weekend.
Oh, absolutely. And we want to thank all of our soldiers for all the work that they have done to protect our country, and also to recognize that yesterday we had numerous flag lowering and flag ceremonies throughout our Kaleida site. So again, I want to thank our DEI team for putting that together, and I want to thank all of our veterans and those who are currently serving and have served, and loved ones who have gone on to glory. But Lisa, the Visiting Nursing Association, I feel is fascinating. I have to say, I have had loved ones. My parents, as a matter of fact, were assigned to, or I don't know, given a prescription. I don't know the correct term for the VNA. So let's start. How long has the VNA been in Western New York, and what are the counties that the VNA covers, and what is the VNA?
Sure. So, well, thank you so much for that. The Visiting Nursing Association of Western New York is actually the oldest home care agency of its kind in the nation. So we're really proud as part of Kaleida Health to be the very first who provides home health care in the country. And it's, it started from sort of humble beginnings as a charity with the First Presbyterian Church, but it's grown now to, today we serve over, we do over 400,000 visits a year, and we cover 10 counties, the 8 counties of Western New York. In addition, we have Livingston and Steuben County. And as you mentioned, our hospital down in Bradford, we also have an agency down in Bradford called the VNA of Northwest PA that has a home health agency and a hospice as well. So we have a very broad reach throughout all of the area. So we're able to serve patients, not only from Kaleida Health, but also from surrounding areas, north and to the east, and of course to the south as well. So a very broad reach, and again, a very long history of providing care in the community.
Yeah, thank you. And I just want to mention to our listeners that even though you said it was started by the Presbyterians, all religious denominations are part of, are welcome to,
Of
and can
course.
receive. Yes,
Yes, of course. Yeah, it
I didn't
actually
want to.
wasn't. No, we started as a charity, but it is. We were very happy and proud and humbled to serve people of all religions and nationalities and cultures, and we do because there are so many of us in different that come from different areas and have different beliefs and so forth. So we're very proud to be able to help people, whatever their need is.
Whatever their needs. Thank you. And speaking of whatever their needs, what services does a VNA provide? And is there an age for the services provided? And what are the hours?
Well, we provide services 24 hours a day, 7 days a week, 365 days a year. We're always here. Most of our services are provided in probably between 8 and 8:30 because that's, when most people are awake and need, can receive their services. But we do have on call and our nurses are available to answer questions during on call, and we make visits if need be. But the services that we provide typically are things like skilled nursing. So patients who may have been hospitalized with perhaps they had a cardiac issue, some surgery, a new condition, cancer diagnosis, perhaps. Or we have brand new babies who came out of the NICU. So all age ranges. We're very fortunate to have teams of nurses that have expertise in all age ranges. And the what we provide is in the home are direct hands-on care, so helping either dressing changes, assessment, teaching. A vast majority of our services, in all cases, actually, our goal is to help people to be independent. So while we're still there, we're doing our services, providing care, providing wound care, providing IVs, whatever that might be. We're also teaching. So we're always teaching people, the individual and their family about what to look for, how are you going to manage your disease. So nursing is our primary service that we provide. And again, for all types of conditions, all types of conditions
Yes.
in all age ranges. But the next largest really is physical therapy. And we are the largest employer of physical therapists in Western New York. Many, you mentioned, are the types of services that Kaleida Health provides, including our outpatient ambulatory surgery centers. We have a very large amount of patients who have a hip or knee replacement done, and our therapists see them the same day or the next day. So they never have to go into a hospital or to a rehab facility. And we're able to really just take care of that patient at home for the time that they need to recover, and they can recover on their, in their own bed and up and down their own stairs, or learning how to function again within their own environment. So therapy is our next biggest. And then we have occupational speech, social work, dietitian, home health aide. Our specialty areas, wound specialists, pediatrics, behavioral health. I think I mentioned our IV team. We also have our own infusion pharmacy and our own fleet of drivers that will provide, deliver the medication to patients' homes throughout our entire service area.
I didn't realize that. I
Yeah,
didn't realize you had that. Okay.
yeah, we do over 100 deliveries a day. So they're out in meeting the nurse or making sure if somebody's IV is due at 8 o'clock at night that they get that medication there before the nurse gets there so that the patient can receive their medication. I wanted to just touch on one thing that when you mentioned the GVI, which of course is world renowned and the stroke care that's provided there. Recently, the VNA hosted a stroke certification program for primarily therapists. And there were attendees from across the country that came to this program. And I'm very happy to report that we have 11 certified stroke therapists on staff now, and as well as 2 from Buffalo General that attended. Prior to this program, there were only, I think, 2 or 3 in the entire area that were certified in stroke. And now we at VNA and Kaleida Health have a larger number of stroke certified therapists that work together with our partners over at the GVI and Buffalo General and Suburban to take care of patients who have had a stroke. So that's very exciting for us.
That is that is very exciting, and and on that note, I have to also say that I know a couple of weeks ago we had one of our physicians from the stroke center talking about our community. I'll get the information straight next time. But we have family stroke, it's like a
support group
conversation support group.
Yep,
Thank you so much.
Yep, and VNA joined in that, so it's really great because sometimes after a stroke people think I've reached a certain point, and but there really may be more that we can do. It's like other diseases or conditions. Sometimes it takes longer to reach a fuller potential, and I think working together with those in the stroke support group, then we can also be a resource to them to say, what, maybe you're not plateaued. Maybe it's time for another referral to VNA, and we'll come out and see if there's additional progress that can be made. But it's also an opportunity to share your feelings and thoughts and experiences with others. So yeah, we're part of that, which is great.
Oh, that is great. Yeah, because I know you just talked about family being there when the VNA comes, so you can assist your loved one. The stroke support group is also for families.
Yep, absolutely.
And I know that I'm hoping to at least attend one of the meetings, because although my parents are deceased, they had strokes, totally different kind. Totally.
Yep.
Yeah.
Yep.
So just to, it makes you very humble. Very humble.
It does.
Yes.
It absolutely does.
So if one of our listeners right now is thinking, wow, this is a perfect service for my new, for my 8-year-old, if something happened, or for their mother, father, aunt who's at home and just struggling, how do you go about getting services? Do you go through your primary care physician and they connect? So how does one get started if they feel they need services provided by the Visiting Nursing Association?
So usually our referrals come either from a hospital discharge planner or a doctor's office, which could be the primary care physician, or it might be a specialist. It doesn't matter. We do require a physician's order. But if patients someone may call and they're just not quite sure how to go about it, we can help them with that. And we can actually contact their physician and obtain the necessary order. I think one thing to note is sometimes people don't really know, do I need the services or not? We can always do an assessment. And sometimes that's, let us come out. There's not a charge for the assessment visit. We don't bill insurance for that. If it's just one visit to see what's going on, we would just, let's go out. Let me see if we're right for you. Maybe there's another service that we think could meet your need in a different way, or we can link you. So people can just contact us and we'll help figure it out together with them. But again, most come through the doctor or the hospital, but people can call 630-8000 and we'll ask for our intake department, and we can figure it out together.
And if you could say that number one more time.
Sure. 630-8000. And that's our main office here in Erie County, and all of our intake is here. So it doesn't matter where the listener lives within our service area, we can take care of that out of this office.
Yeah, yes, and because you can now listen through Google, we could have a listener visit in Portland, Oregon on their way home, on their way home to Western New York.
We don't serve Portland, Oregon yet, but you never know.
But they could be listening. But they could be listening and call their family member. So this is such a unique service. So VNA nurses or anyone part of the VNA team, a physical therapist, do they receive special training for working with the community because they are working in the community?
Yes, I think what we like to do when we have someone apply, we actually like to take them out on a shadow visit. So they'll go with an experienced nurse or therapist so that they really have an understanding about home care, because it's not private duty nursing. And I think sometimes people think it's private duty nursing, but it's not. Our nurses and therapists are seeing, 5 or 6 patients a day. So we really are going from home to home to home. And we want to make sure that they have an understanding. So that's kind of the first and foremost. But we provide an intensive orientation for our new employees. There's a 3-month orientation program that can be extended as needed. And during that orientation, they have a preceptor who's an experienced clinician. And they also, when they're finished with their orientation, they have a mentor. So somebody who will stay with them for a whole year afterwards to serve as a sort of a peer resource. And also during our training, there's intensive training on wound care. If they're an infusion nurse, there's IV care, there's infection control. There's a whole host of training that takes place. I like to think our nurses are they become really I'm going to say a jack of all trades or a Jill of all trades, because you never know, you're seeing patients. It's not a specialized floor. So you're seeing patients who have multiple conditions. They have had a heart attack and they're a diabetic and they've got a wound on their foot. So you need to be an expert in a lot of areas. And on top of that, it's really important that we understand the insurance that patients have, so that we don't want our patients to have excessive, any co-payments if they don't need it, or if their wound supplies, we want to make sure it's covered. So we really work hard to make sure that we can kind of look at the whole patient and the whole situation and maximize the care that we provide and minimize any cost to the patient.
Yes, and I have to admit that, but another service I know you provide, again, seeing a family member who needed to take their blood pressure every day, and there was a machine and there was a scale where they had to weigh themselves, and then they had to take their blood pressure, and it was computerized, and I don't recall, did they call the information in? So this way, the patient, because they were at home, did not have to go to the hospital, their doctor. The family member did not have to take them to the doctors, because they could do all of this. I'll take their vitals to a point at home and send it into the VN.
Yeah, that was our telehealth program. That's kind of
telehealth.
Yeah,
yes.
That's kind of we're a little bit we've kind of put a pause on that right now, because what we've done is actually we provide a scale to our patients. We think that it works best we provide a regular scale that people are used to using, and we teach them, to weigh yourself and record it, and so and what to look for. So that they know if I've gained, X amount of pounds in a short period of time, it could be fluid weight, and that could be detrimental to my heart. So we've tried to switch things out a little bit, and we think that using like the regular scale it helps people to manage themselves better, self-management. And then we help people if they need a blood pressure cuff and we'll help them select a blood pressure cuff that can be easily used by them. And the same thing, record your own. We want you to take care of your own vital signs, your own weight, so that you know when we're no longer coming to see you, when it's time to call your doctor.
Yeah, I think that's great. So over the years, and we talked about telehealth, pretty perfect segue. How have you seen, or what have you seen or heard and researched about how the services have changed?
Yeah, I think that we're finding in the healthcare industry that there's a shift, of course, to moving patients to community-based care whenever possible. So patients are staying fewer days in the hospital or not going into the hospital at all, as I talked about with the patients who need a hip or knee replacement. So I think over time, we're continuing to see patients who have higher acuity, they're sicker. And so we're seeing people that really in days gone by would have been hospitalized longer and now are being discharged quicker. So we're able to take care of patients that have a higher acuity than in the past. And I think that will continue to be the trend. Community-based home care, what VNA provides, is a very cost-effective way of providing care in the home, providing care in general in the whole healthcare system. And I think that we'll continue to see a shift of either avoiding hospitalizations by referring in home care, or maybe shortening hospitalizations by referring in home care services like VNA. So that's I would say is what I've seen over time, is that patients are sicker when we see them. And but I feel comfortable about being able to care for people in the home. If a person really needs hospitalization, and many people will, then that's fine. But if they're stable enough to come home, I would like to have them home. Everybody really wants to be home. And so,
Yes.
If we can do that, I think that we'll continue to push to be a resource for our hospitals, for our nursing homes, for other referral sources to be able to take care of people at home rather than in an institution.
Yeah, and I have to, and sometimes it can, having that loved one at home so early can seem like a burden on the family members, because they're used to the person being in the hospital, and now the family member, because sometimes someone needs to be there with that loved one, has to make arrangements for family leave, filling out family leave papers. And I just want to say that if someone is, your loved one will be coming home earlier, ask in advance if we got to get a family plan together to see if maybe you or someone who, in your family has, can have the family leave time, or you just may have to come together, and not you'll have to come together sometimes and have a plan.
Yeah, that's a good point. I think that's a really good point. I think especially someone who's hospitalized, I think the family meetings about how we're going to care for our loved one now are really important, so that you need to understand the commitment to that and what you'll need to do. And are you, like you say, are you going to need to prepare for having some time off? Right. I think a family meeting is a great idea.
And that also, to let the listeners know, you can have the family meeting before your family member leaves.
Absolutely.
So if you have questions of the VNA, if you have questions of the doctors or of the nurses on care for your loved one, once they get home, please do not feel as if you're all alone. You're not. They are there for family meetings to help you, because they want your loved one to get well and be at peace and be at home and comfortable. So don't feel as if you're all alone. You can have that meeting before they leave and write the questions down in advance, just so you don't forget them. You don't have to, but sometimes it might help.
Yeah.
Um, yeah, but Lisa, I know we're running out of time. If someone is interested in applying for a position with the VNA, do they just go to the Kaleida website /careers, Kaleida Health /careers? And is the VNA, are the VNA positions in part of the Kaleida website, or do you have your own jobs?
We
Job
have
area?
both. Yep, we have
Okay.
both, Francesca. So they can go either to the Kaleida Health and I'm not sure if it says VNA or it might say home care. And then or VNAWNY.org. And that will also list the positions that are available. And we would love to have people apply. And, like any job, it may or may not be for you, but come and talk to us and, find out what we have going on. We will have some open interview sessions coming up. I don't have the dates right now, but they'll be up on our Facebook page and on our website. And we encourage people to come and just, find out about home care. I'm a nurse by profession, and I can speak to, although it's been a long time since I've cared for patients in the home, that it's extremely satisfying to be able to provide one-on-one care to people in their home. Because like I said, people want to be cared for at home, and to be able to provide that service is really amazing. And to be the nurse or the therapist or the aide who's there helping people to achieve that goal, it's extremely rewarding for you as a provider. And it's so, I don't know, it's so humbling and so amazing to see the impact that you can have on people's lives.
Well, Lisa, yeah, on that note, I'm going to say thank you because we are out of time, believe it or not.
Okay.
And we are out of time. I want to thank Lisa Greiser, Senior Vice President, Home Care Visiting Nursing Association. If you're interested in applying for one of the many positions offered by the VNA, please go to either the Kaleida Health website or the Visiting Nursing Association of Western New York website. And on that note, I want to say again, thank you, Lisa, for being our guest on the first half of the Great Lakes Health radio program. Thank you.
Thank you so much. Thank you.
You're welcome. Listeners, hold on. We have the second half coming up momentarily. And now on to part two. And welcome back to the second half of the Great Lakes Health radio program with Kaleida Health. I'm your host, Francesca Messiah, Manager, Workforce Development. And I'm hoping that you enjoyed the first half of our show that talked about the Visiting Nursing Association and with Lisa Greiser, the Senior Vice President of Long-Term Care and the Visiting Nursing Association. But now we're going from Visiting Nursing Association, and our second guest is a nurse. However, today's topic, we will be talking about maternal mortality. I'm going to say that again, maternal mortality, very important topic. And our guest today, our expert, not only is she an expert in this area, she's been asked to speak on panels throughout New York State, and I'm sure across the country. And our guest for today is Luann Brown. Good morning, Luann. How are you?
Good morning, Francesca. Good. How are you?
Great. And Luann is a registered nurse and also the CEO, Chief Executive Officer of Buffalo Prenatal and Perinatal Network, which has been in Buffalo for 40 years, Luann?
Yeah,
How
since
many years?
1987.
1987. I know it's been a long time. And, Luann, we are just going to jump right into the interview because the topic of maternal mortality, I don't want our listeners to miss one bit of information on it. But can we just start off with, could you just share, for those who don't know, what is the history of Buffalo prenatal and perinatal, and what do you attribute to the success of an organization that's been in Western New York since, would you say 1987?
Mm-hmm. Mm-hmm.
Okay.
Yes. So we Buffalo Prenatal Perinatal Network actually was originated by Governor Mario Cuomo, for some of you young people that remember him. And he was concerned about the high rates of low birth weight and infant mortality rates in New York State. So he created, I think it was 16 at the time. I think we're down to 14 networks. So we have peers across the state. So that's our primary focus, is reduction of low birth weight and infant mortality. I would say the success of our program is due to our staff. We are a home visiting program, and we have two separate programs. We have a Healthy Families New York program, and we have a community health worker program. They both focus on pregnant and parenting women, primarily on the east and west side of Buffalo, because unfortunately, that's the areas where many Black and Hispanic moms live, and they have the highest rates. Healthy Families does go a little further out into the outer ring suburbs. They do Cheektowaga, Lackawanna, South Buffalo, a little bit of Tonawanda, a little bit of Hamburg. So because we're home visiting, we spend a lot of time with the clients and we see them in their homes, which is a privilege for us, because it's hard for people to let you in their homes, and we really have to gain their trust. But my staff are from the communities we serve. So the majority of my staff are Black and Hispanic. Probably 30% of my staff speak Spanish. So they're considered trusted advisors. And I think when they go in there and they work with the moms, depending on which program they're in, anywhere from 2 to 5 years, and, do a lot of education on parenting and child development, but also on health issues. We make sure they go to their prenatal visits, their postpartum visits, the well child visits, that they're getting immunizations, all those important things. And I think that, but we also work with the social determinants of health that most of our clients face, whether it's housing, which Francesca, I don't have to tell you what a nightmare housing is in Buffalo. And I won't go on my housing rant, but again, housing is an issue for, we do not have enough housing for families. And my staff has become much more involved in this process. We have, the homeless moms. We have moms we have to get out quickly because of domestic violence. And the majority of our moms are just in substandard housing. And that might be lead, that might be mold, that might be rodents. And no one.
It might be all of the above.
And it might be all of the above. And really, no one, we're talking pregnant moms with kids. So again, if anyone's out there listening that wants to help us with that, I'd be really happy. But housing is a huge issue. But we also deal with things like, food insecurity. So it's pantries, whether they have baby basics, do they have a crib for the baby? Do they have clothes for the baby? So that's kind of the role that we play. And then we also have a newest program, which is our fatherhood program, because I felt when I started it a couple of years ago, we were kind of missing the boat with dads. Dads are very important to the whole structure of the family. And unfortunately, the United States has the largest number of fatherless families in the whole world. And research shows when there's no dad in the home, there's outcomes like, drug use, criminal justice involvement, dropping out of school. So dads are important. They do play an important role, and we're trying to, ensure them and raise them to that level because they are important.
Yes, they are very important. And I just want to say that I yesterday, when just doing a little bit of research, you're when you pull up the page, Buffalo Prenatal and Perinatal Network, and everything what you're saying right here, it says linking women. We've talked about women, linking women, fathers, and families to a better way of life. And that's exactly what you have just summed up. So I just want to say thank you for your leadership and all you've done. I work closely with you on other committees and with the Near East and West Side Task Force. I just want to say thank you. Before we talk about the topic of maternal mortality, based on what you just finished, the overview of Buffalo Pre and Perinatal, if listeners are interested in the services, whom should they contact?
Yeah, they can call us. Our number is 716-884-6711. And if you go to our website, which is www.bppn.org, You'll see all our programs, providers or social workers or nurses. You can make a referral. Each program is listed. You can self-refer. We get a lot of self-referrals or word of mouth referrals. So everything is on that page. And that's the easiest way to get a hold of us.
Thank you. So I'm with our topic of today, maternal mortality. What is maternal mortality?
Well, maternal mortality defines, as a mom who loses her life, and it depends. Sometimes they will define it. It's usually during the pregnancy period or up to 42 days after. Um, New York State, part of, now we're going into the Cuomo family, but Andrew Cuomo a couple years ago did a whole women's agenda. And one of his points was he developed this maternal mortality review board. So they put their first report out a couple years ago and it was covering 2018, but they just recently sent out the newest report, which covers 18 through 20. And it's not great. They're showing that in New York State, for every 100,000 of the thousand deliveries, we have 19.3 deaths. The Healthy Families Goal, which is out of the CDC for 2030, is supposed to be 15.7. So we're already over the mark. What's more disturbing is that in those numbers, and this is nationally as well, is that Black women are 4 to 5 times more likely to suffer maternal mortality. In the period from 18 to 20, there were in New York State, there were 386 maternal deaths. The majority of them were the moms who were over 30 with less of a high school education and were on Medicaid. The three top reasons for the maternal mortality were hemorrhage, embolism, and very concerning, which kind of popped up in this last report, mental health conditions, which can be substance abuse like overdoses, but also suicide. There's been a spike in those numbers, which is very concerning. And half of the deaths occurred 42 days after the birth of the baby. So that speaks to the importance of that after, and sometimes moms, they have the baby and it's very difficult, not for us, but for a lot of providers to get those moms to come back in for that, that 6-week postpartum visit. They feel like they're fine or else they're exhausted. They just don't go in. And we are like over 95% in getting our moms to their postpartum visits. Important, not only for the physical, but the mental check-in. So I think that's just stresses the point, that all those issues. I mean, we've started last year through some funding from the Cummings Foundation. We started a self-monitoring blood pressure program where we give our moms in the last trimester, or if they're 8 weeks postpartum, we give them a blood pressure cuff. And it's very, very simple, like education. We give them an educational sheet. We go through. It's one of the electronic ones. It's very easy to use. We give log sheet to record it. We tell them what's normal. We also give them health tips, whether it's, exercise or diet. And we do that because those are the critical periods, and you can't just forget about the mom after she delivers. And the data just speaks to that 40, the majority of those are occurring after. And the other disturbing part was that 73% of these deaths, this mortality board determined were preventable. And in almost half of them, the board determined that there was some type of discrimination in the case. So that speaks to everything, that, we try to work with our clients on. And, implicit bias, Francesca, you and I have talked about this. I mean, and I'm a nurse and nobody goes into the healthcare field to be biased against their clients. But the reality is, if you have not had that lived experience, I mean, I certainly have not had that experience. So, which is why I listen to my staff and my clients. You don't do it, but if you're not used to that culture. So, New York State also put in a lot of training that like the medical schools have to do. I'm really interested in doing some implicit bias training. I'm actually working with a an actress from San Francisco that has done like vignettes with music, but we really are looking at doing vignettes on different implicit bias scenarios and showing those to not only medical students and OB residents, but nursing students, social workers, anybody that interacts with the mom, because they all can have an impact. So that's important. I mean, the hospitals have really, when you hear about the things like the hemorrhage being the number one cause. So the hospitals have put in place with New York State like hemorrhage drills, and they have hemorrhage carts where they almost do like a fire drill. It's prepared so that if a mom starts to hemorrhage, they got everything right there. Everyone knows what to do. And I think that's had an impact, and it will have an impact. Um, I think the mental health, we just did it for our Black Maternal Health Week this year. We focused on mental health. And some of the statistics were like so scary that they're saying that 1 in 4 women are listing at OD as their leading cause of death. That Black women, again, 40% of Black women experience mental health issues more than white women, than all women. Um, They said that 14% of women have a new episode during pregnancy. Some of them, 14% deliver 3 months after birth. Again, that important postpartum period. And then the other issue is only 20% of women are screened, and half of women don't receive support. So, depression screening is becoming more common, and with physicians, we screen in our programs, both the programs, we screen at different times during the pregnancy. Um, and because of that, like several years ago, we noticed first in our community health worker program that we were getting high scores, and our moms are very nervous about going to a counseling service because they're afraid someone's going to take the baby away. So they will not, and there's still the stigma with mental health.
Yeah, and yes, and can I just interject real quick? And it's true. I mean, growing up, sometimes you would hear you don't want to go. So it is something that has, I don't know if I should say culturally,
Uh-huh.
but it really is. I've had the conversation many times. You were told don't go because it'll
Don't
stay
go.
on your record. It'll stay on your
Right.
record forever.
Right. Well, and when we did the mental health conference, we had 2 of our clients speak, and one of the clients spoke to that. She said, my family, that was not the message we got growing up. It was kind
Never.
of like suck it up and just deal with it. But I mean, so we ended up starting, we just have kicked off our second one in Healthy Families. But so we run an empowerment group, that's what we call it, for our moms with depression, like once a month. And we have a mental health counselor because my staff are not clinical people. So we have a mental health
Right.
counselor come in, and try to deal with them, teach them strategies. But the goal really is to get them comfortable with a counselor so they'll do individual counseling, which is really what our goal is, because that's what they need. But I mean, that's important. The screening is important. They said that the other thing that was concerning, they said that a new mom's odds for suicide are 7 times after the diagnosis of perinatal depression. And it lingers. They said like 5 to 18 years after they get diagnosed, a mom who had perinatal depression, her suicide rate is double a woman with no depression. So, and there's a lot of things we need to do with that. Obviously, getting rid of the stigma, the implicit bias, and we also need to have providers that look like our clients. I mean, that's the one thing my clients always ask for. They want to go to somebody that looks like them. That's just the way with everything.
True,
Um,
but and then you hope that when they look like them, they are just as
right.
empathetic,
That's
Yeah.
right. That's right. And I think that, that also means, and, the support groups are important. But, the other thing, it's these underlying social determinants of health, that also stress moms. So again, when we start with a mom, we can't all of a sudden start talking about their health goals, because we might need to deal with the fact that they don't know where they're sleeping that night. You can't,
Yeah. And
prioritize things.
you're right. And anyone who knows me knows that I call it the social determinants of life.
Right.
It's not just the social determinants of health, because like you said, health could be number three.
Right.
If you're a pregnant mom and you're being evicted and you have a family, you
Hmm.
know, You then have to many times put your clothes in plastic bags because you don't have a suitcase. I know
Right,
people talk about plastic bags, but plastic bags in many families become a lifesaver
right,
because the cloth bags cost money. I mean, that's a
right.
whole area. But in terms of you know, in terms of the what you provide and talking about maternal mortality,
Hmm.
who so does Buffalo prenatal and perinatal work with certain zip codes, or are there
Yes,
zip
yes.
codes, or I should say, what are the zip codes? I would just want the, for our listeners to know, like the zip codes that you've always worked in. It's not new.
No, it's not new. It's mostly east and west side. I can actually rattle them off to you. Give me 1 second. I got them right here. But it's mostly east and west, and we do a needs assessment every year because things change. We'll find, with gentrification sometimes, we'll go into a zip code that we used to be forever, and the population has totally changed. So we have to kind of adjust to that. And we look at the newest stats. So I'll just rattle them off here. So it's 1 4. So it's 201, 202, 203, 204, 206, 207, 208, 209, 210, 211, 212, 213, 214, 215, 216, 218, and 225. And then Healthy Families does also go into, because I mentioned they do 150, 219, 220, and 222. So those are pretty consistent what we've done, the areas that we've gone into. Um, yeah, but I guess, it really is, with the mental health especially, those social determinants of health are just our life, as you say it, which is true. It's just you have to get them stable because they can't concentrate on anything until they know they've got security in a safe environment and their kids are safe. Um, so I think that's been a big focus um, of the state. And that's kind of like, and nationally, President Biden just came out with a whole new, I haven't read it yet, but he just came out with a whole new mental health report with solutions um and those kind of things, and I think, and I'm going to be, selfish and say here that, they should be investing in organizations like ours because, and I worked at Children's for 30 years. I worked in the OB areas and I know the caregivers, how busy they are, but they're not, when they're seeing that client for a snapshot, but when they go home, we're with them all the time. So we really have our eyes on them. And that's why, we make sure, we're calling and making sure they're going to their prenatal appointments. Sometimes we're transporting them or we're providing transportation. I mean, the other program we have, which was done in concert with United Way and the NFTA, federal grant, is Go Buffalo Mom. So we have a transportation navigator that is in the prenatal clinics at both Kaleida and the Catholic Health, as well as we just kicked off something with Neighborhood Health Center. Because transportation is like one of the biggest barriers. Well, they did the focus group with our clients like 10 years ago. That's why they wrote the grant. So this person basically, connects with the mom, and it's either she gets them bus passes or if they're eligible for Medicaid cabs, she'll arrange the cabs for their whole appointment. And it's, the recent report that we just ran that our Jubal College actually did the evaluation on the program. And, again, we can't take credit for all of it, but except during COVID, because nothing was normal during COVID, the moms that were in Go Buffalo Mom had less kids in the NICU, and if their kids were in the NICU, they were in there shorter periods of time. So it does make an impact. I mean, they have to get to their prenatal appointments because if there's going to be an issue that arises, um, they're gonna that's when you pick up on it. And if they're not going to their appointments, it's going to be a problem.
Mhm. So Buffalo Pre and Perinatal keeps up with the family. How do they do that?
All right, yeah. So no, we're in the home. I mean, during COVID, I mean, we were maybe virtual for a couple months. In August, we went right back out in the home because a lot of times we're the only support these moms have, and we were still delivering diapers and food and all those kind of things. But we usually early, like Healthy Families has got a very structured, how often they see the mom when they're pregnant. And we obviously like to get the moms when they're pregnant because so we can have a longer impact with them. But when the baby's born, they're in there every week for 6 months. With community health worker, they tend to get, they're looking for the mom that's not connected to the system. So they're the most, probably like even more vulnerable. So they could spend like 6 or 7 visits the first 2 weeks because they're taking them to DSS to get their benefits, and they do street outreach and they get a lot of referrals. So when the weather's nice in Buffalo, they're in the neighborhoods knocking on doors. They go to the bus station, they go to the train station. We find moms under bridges. We found a mom living in her car with her toddler like 2 years ago. So it's this constant interaction where they've developed a relationship and they have to build that trust. You know how they've been burned by the system, our clients sometimes. So they're very mistrustful. So we have to really prove ourselves to them. And then of course they never want to leave us. They're like, we want to stay. We don't want to graduate. But so it's the home. I think the home visiting is key because, and I laugh and I don't mean to be cynical, but when people say, well, we call people on the phone, well, do you think they're telling you the truth? I mean, sometimes they're embarrassed. They don't want to tell you what's happening. And I think when we walk into the homes, we see the mom laying 8 months pregnant, laying on the floor because she doesn't have a bed. We buy a lot of mattresses and box springs. We open the refrigerator and there's no, you know what I'm saying? It's a very different experience. And you see what's impacting them when you're in the home.
And I just have to say, Luann, that my very first job out of college was housing. And it's when I worked in housing, I was housing specialist, Maston District, Cold Springs, and there's one other area, but all in the between Dodge and Main Street. The whole point is that when I would see flies in sub-freezing weather flying around in homes, or when I
Oh,
saw or leaky roofs,
right.
and there was a direct relationship to healthcare, and that's when I knew in time I was going to move into healthcare
Yep. Yep.
because I you just see and my background is sociology, but that was the whole relationship and made me realize that your health and your housing went hand in hand. So yes, going into the homes versus a text or whatever. There's so many ways of communicating. And I know we don't have much time left, which means we're going to definitely do another show.
Okay, we will. Great.
Let's probably. I'm just gonna put September
Okay.
because it's back to school, because I want to talk about again, maternal mortality, huge. We will be back in a few
Okay.
months to talk more about that. Upcoming fundraisers, because funding is what keeps your organization going. And I also want to say you also do hire staff who have been moms. So I just want to let people know that Luann walks the walk, talks the talk, walks the walk. But I want to talk about your fundraisers before we have to go. You have two big ones.
Yeah, so we have our big fundraiser is Great Baby Beginnings. It's July 24th at the Foundry. It's a very nice event. It's like 5 to 8, and we do, there's food and drinks, but we do give some awards out. Some of our clients speak, which is probably the most impactful part of the whole thing. We are also, if anyone's in a cocktail mood, we are doing a fundraiser at the XYZ, the 500 Pearl bar, actually both bars. It's an easy lift for us. Anybody who's in there will get $1 for every drink of anyone who drinks. So there's that going on. But the Great Baby Beginnings is the big event. That information's on our website.
And where is that? Because I'm putting it on my calendar right now. Where is that?
Which one? The Great
Great
Baby
Buffalo.
Beginnings? Yeah, it's
Yes,
at the Foundry. Same
the
place as
foundry.
last year. Yeah, yes, at the Foundry on Elmwood. So yeah, because we're 95% grant funded and our grants do not always fund things like beds. So we rely on grants and and smaller grants, fundraising, so we can buy beds or refrigerators or stoves for our clients.
Mm-hmm. And then let's say, and where's the second one? At the 500 Pearl?
The second one, yeah, the second one is it's at 500 Pearl. So if you're at the rooftop bar or on the
Yes.
bar in the hotel, anybody who's there, any
And what's the
drink.
date?
It's June 28th.
Yep, I have that on my calendar already.
Okay, because it's a Friday. It'll be fun. That's right.
It'll be fun. Yes. And Luann, I just want to thank you for being our guest. We have barely scratched the surface in maternal mortality and your expertise in that area, but I'm going to bring you back
Okay.
in September. I'm going to just put a little note to myself. I'm going to do the second, because we're the second and fourth Friday, second and fourth Saturday. So I just
Okay.
want to thank Luann Brown, CEO of Buffalo Pre and Perinatal Network, for being our guest this morning, the second half of the Great Lakes Health Radio program. Thank you, Luann. And next week, you'll hear from Cindy Bass, my esteemed colleague from ECMC. And I also want to let our listeners know, please look for our health pavilion, the Juneteenth share that Kaleida Health and ECMC share at Juneteenth. Our pavilion is normally, it faces a parade route, and we would be like the last large pavilion before the grandstand, which is a way of looking at it. And I just want to thank our listeners again for listening to the Great Lakes Health Radio program here on Power 96.5 FM, WUFO 1080 AM. And also, don't forget, if you're in need of a job, want to begin a new career, please check out the Kaleida Health website. My name is Francesca Messiah, Manager Workforce Development from Kaleida Health. And I want to say have a very safe week. Bye-bye.